Centre for Covid-19 announces bubble and seal measures after the 1st of October with quarantine lifted. The latest news is bound to exasperate potential tourists thinking of visiting Thailand after the 1st of October, as Friday's announcement has created more confusion than clarity as to what will happen after that date. The government has also announced shorter quarantine periods from the 1st of April, with 10 days for unvaccinated visitors and 7 days for those with vaccine certificates. An announcement by the Centre for Covid-19 Situation Administration on Friday that Thailand is to reopen to tourists from the 1st of October next without quarantine has been tempered somewhat after it was revealed by the body that bubble and seal measures will be deployed at tourist destinations and transport facilities after that date. The announcement by the Centre for Covid-19 Situation Administration, CCSA, has caused some confusion as foreigners seek further information on what bubble and seal measures will mean, fearing it could just be quarantine under another name after the 1st of October and without clarification either on when the controlled regime for entering Thailand will cease. On Friday, the Centre for Covid-19 Situation Administration confirmed that Thailand will be reopening for foreign tourists without quarantine from the 1st of October. However, Dr. Torsilp Viswanathan of the CCSA explained that the kingdom's authorities would be deploying close observation devices thought to mean tracking apps and what he termed bubble and seal measures, which will be enforced at airports, tourist destinations and communities nearby. Seal and bubble measures in Samut Sakhon province recently saw workers in local factories being denied permission to leave their workplaces there. It is not clear what these measures entail as of yet. However, Thai public health officials have used the term bubble and seal in relation to measures recently to curb the COVID-19 infection rate within the hard-hit Samut Sakhon province. These involved confining workers to factories for extended periods. At the time, Deputy Spokesman at the Ministry of Foreign Affairs Nithapan Unopakan referred to this as providing accommodation to workers within factories and preventing them from leaving the premises. In the last 48 hours, Thailand announced that the outbreak in Samut Sakhon has been brought under control and that it is no longer a red zone for the infection, the last such designation within the country caused by the second wave of the virus. Shorter quarantine periods were confirmed. Dr. Torsilp also announced that from the 1st of April to the 30th of September, quarantine on arrival would be reduced from 14 days to 10 days to incoming passengers without a vaccine certificate and COVID-19 free certificate. The visitor would still be subject to COVID-19 testing during this period, with 1 test for those with a COVID-19 free certificate on entry and 2 for those without. It is also proposed that quarantine within hotels for such visitors be eased to allow hotels guests access to certain amenities including gyms and swimming pools. Guests will also be allowed access to controlled areas in their locality for exercise and shopping. From the 1st of July, quarantined guests will be able to access restaurants within hotels and massage from the 1st of July to the 30th of September. This flexibility will be extended to include hotel restaurants and hotel massage facilities. Dr. Torsilp confirmed that the quarantine period for people with a vaccine certificate will be scaled back to 7 days from the 1st of April, with 1 or 2 tests after arrival depending on whether they arrive with a COVID-19 free certificate or not. Thai PM announced a new, more robust and positive approach to the kingdom's vaccination campaign following last Tuesday's inoculation of the Thai cabinet and the Prime Minister at Government House. General Prayut took many observers by surprise by reversing government policy and easing access to vaccine products for the private sector and groups wishing to vaccinate local employees or community. He signaled a more robust and confident approach to handling the vaccination process, similar to the successful approach undertaken in the United Kingdom, where over 24 million people have already been vaccinated and 1.6 million have received a second dose. We urge the Public Health Ministry to allow hospitals to import COVID-19 vaccines without waiting for the government's approval, as we aim to vaccinate 10 million people per month, said General Prayut. Success of the United Kingdom's program based on opening up access to the private sector and nationwide availability through the NHS. The success in the United Kingdom has been achieved by opening up the program to the private sector, including the involvement of supermarket chains and making vaccine doses as easy as possible for the public to access through the country's NHS or National Health Service, which operates all hospitals. The announcement by Prime Minister Prayut this week was a direct reversal of emergency regulations issued by the Ministry of the Interior and the Ministry of Public Health to control access to the vaccine some weeks ago. This order prohibited any foreign manufacturer from discussing the sale of vaccine products with customers in Thailand except the central government and banned importation by such parties. Question regarding certificate of entry operated through embassies and Ministry of Foreign Affairs. Amidst the flurry of announcements today, there is still the key question of the system being operated via Royal Thai embassies worldwide, where visitors must obtain a certificate of entry to visit Thailand and emergency provisions regulating commercial air flights into the kingdom. The laborious and tortuous nature of the process will certainly hinder Thailand's prospects of achieving foreign tourist numbers at anything like the scale seen in previous years. The Center for COVID-19 Situation Administration today announced another extension of the emergency decree until the 31st of May, which governs such provisions. Speculation on an end to the emergency decree. There had been speculation that it may expire before a full reopening on the 1st of October, but today's announcement regarding bubble and seal measures being deployed at tourist destinations appears to suggest otherwise, although such measures may be possible under the 2015 Communicable Disease Act, which allows for local quarantine measures. The government's quarantine measures have been disastrous for the foreign tourism industry in Thailand. The current controlled and highly restrictive regime saw a loss of 99.8% in visitor numbers in January this year compared to last. Bubble and seal measures require clarification. A survey by the International Air Transport Association, IATA, last year also showed that 84% of potential foreign tourists would rule out any location which specifies any quarantine measures. Pending clarification of the bubble and seal measures proposed by the government, today's announcement will be a disappointment to many foreign tourists, especially from Western countries such as the United States, United Kingdom, Europe and Australia, planning their return to the land of smiles at the end of the year.